Have you recently started taking magnesium glycinate because you heard it could help you sleep better, relax your muscles, or reduce stress? If so, you're not alone. Millions of people take magnesium supplements every day, believing they're one of the safest and easiest ways to improve their health. Social media is also full of claims that magnesium glycinate can cure insomnia, eliminate anxiety, stop muscle cramps, and solve many other health problems. But here's what many people don't realize. Even a popular supplement can cause problems when it's used incorrectly. The problem isn't always the magnesium itself. Sometimes it's the mistakes people make while taking it. Some people take much more than they need. Others take magnesium too close to certain medications. Some expect overnight results, while others continue taking it without ever asking whether they actually need supplementation. And if you have certain medical conditions, especially significant kidney disease, magnesium supplements may not be appropriate without medical guidance. That doesn't mean magnesium glycinate is bad. Magnesium is an essential mineral that your body needs for normal muscle function, nerve function, energy production, and many other processes. Magnesium glycinate is also commonly used because it is generally well tolerated. The key is knowing how to use it safely. In today's video, we'll discuss 7 common mistakes people make when taking magnesium glycinate. We'll explain why these mistakes matter, who should be especially careful, and what you should know before adding a magnesium supplement to your daily routine. Stay with me until the end because mistake number 7 is one that many people completely overlook. Welcome to Dr. Bilal, where we make health information simple, practical, and easy to understand. Let's begin. Let's start with the first 2 mistakes. Mistake number 1, taking more than you need. Many people believe that if 1 capsule is helpful, taking 2 or 3 must provide even greater benefits. But that's not how supplements work. Your body needs magnesium for many important functions, including normal muscle movement, nerve signaling, and heart rhythm. However, taking large amounts of magnesium from supplements does not automatically provide additional benefits. Too much supplemental magnesium can cause unpleasant side effects such as diarrhea, nausea, stomach cramps, and vomiting. In severe cases, especially when kidney function is poor, magnesium can build up in the bloodstream and cause much more serious problems. That's why you should never increase your magnesium dose simply because you think a higher amount will work faster. Read the supplement label carefully and follow the directions provided by your healthcare professional. Also remember that the amount listed on a supplement label may refer to the amount of elemental magnesium, not simply the total weight of the magnesium compound. If you're unsure how much magnesium you're actually getting, ask a pharmacist or healthcare provider. Mistake number 2, taking magnesium too close to certain medications. Another common mistake is assuming that because magnesium is a mineral, it cannot interact with medications. That's not true. Magnesium can interfere with the absorption of certain medicines when they are taken too close together. For example, magnesium may interfere with the absorption of some antibiotics and certain medications used for osteoporosis. This doesn't necessarily mean you can't take both. It may simply mean that the medications need to be separated by several hours. The exact timing depends on the specific medication you're taking. So if you take prescription medicines regularly, don't guess. Ask your doctor or pharmacist how to schedule your magnesium supplement. This is particularly important if you're taking medicines for infections, thyroid problems, osteoporosis, or other chronic conditions. A few minutes of discussion with your pharmacist can help prevent an unnecessary medication interaction. Remember, supplements can affect medications just like medications can affect other medications. Now let's move on to 3 more mistakes. Mistake number 3, expecting magnesium to cure. Everything you've probably seen claims online saying magnesium glycinate can cure insomnia, eliminate anxiety, stop muscle cramps, lower blood pressure, and solve dozens of health problems. It sounds impressive. But real health is more complicated. Magnesium is an essential mineral, and people who have inadequate magnesium intake or deficiency may benefit from correcting that problem. However, magnesium is not a miracle cure. For example, poor sleep can have many causes. It could be related to stress, chronic pain, sleep apnea, medications, depression, or other health conditions. Muscle cramps can also have different causes. So if you're experiencing persistent symptoms, don't simply assume you need more magnesium. Find out what may actually be causing the problem. Mistake number 4, choosing low-quality supplements. Not every supplement product is identical. Different brands can have different ingredients, doses, manufacturing practices, and quality controls. When choosing a magnesium supplement, look for a reputable manufacturer and carefully read the supplement facts label. Avoid assuming that the most expensive product is automatically the best. Price does not guarantee quality. At the same time, choosing the cheapest product simply because it costs less may not always be the smartest decision. Look for clear labeling and, when available, independent quality testing. And pay attention to what type of magnesium you're actually buying. Magnesium glycinate is different from magnesium citrate, magnesium oxide, and other forms. Mistake number 5, expecting immediate results. Another mistake is taking magnesium for 2 or 3 days and expecting dramatic changes. Some people may notice benefits, while others may not notice much difference at all. If your magnesium intake was already adequate, adding more may not create a dramatic feeling. That's why you shouldn't automatically increase your dose, because you haven't noticed an immediate effect. Instead, ask yourself why you're taking magnesium in the first place. Are you trying to correct a known deficiency? Was it recommended by your healthcare provider? Or did you simply see someone online saying that everyone over 60 needs it? Understanding the reason behind supplementation is important. Good health doesn't come from one magic pill or one supplement. It comes from a combination of good nutrition, physical activity, adequate sleep, stress management, and appropriate medical care. Now we come to 2 of the most important mistakes. Mistake number 6, ignoring kidney problems. Your kidneys help remove excess minerals and waste products from your bloodstream. If your kidneys are functioning normally, they can usually regulate magnesium levels effectively, but people with significant kidney impairment may not be able to remove excess magnesium as efficiently. This means magnesium can accumulate in the body. Very high magnesium levels can cause serious problems, including weakness, nausea, low blood pressure, slowed heartbeat, confusion, and difficulty breathing. Severe magnesium toxicity from supplements is uncommon in people with normal kidney function. But the risk becomes more important when kidney function is significantly reduced. So if you've been diagnosed with chronic kidney disease, don't start taking magnesium supplements regularly without discussing them with your healthcare provider. Your doctor may need to consider your kidney function, medications, diet, and overall health before recommending supplementation. Mistake number 7, forgetting to tell your doctor. This is one of the most overlooked mistakes. Many people tell their doctor about prescription medications but forget to mention vitamins and supplements. That's a problem. Your doctor needs to know everything you're taking so they can identify possible interactions and make safer treatment decisions. Make a simple list of your prescription medicines, over-the-counter medicines, vitamins, minerals, and herbal products. Bring that list to your appointments. If you take magnesium glycinate every day, tell your doctor or pharmacist. And if you're considering starting it, ask whether it's appropriate for you. Who should be especially careful? People with significant kidney disease should be particularly cautious. The same is true for people who take medications that may interact with magnesium. If you're pregnant, have a chronic medical condition, or take several prescription medicines, it's also sensible to discuss supplementation with your healthcare professional. And if magnesium causes persistent diarrhea, nausea, abdominal discomfort, or other unusual symptoms, don't simply keep increasing or changing the dose. Talk with a healthcare professional. The goal isn't to avoid magnesium completely. The goal is to use it wisely. Conclusion, plus outro. Let's review the most important lessons from today's video. Magnesium glycinate is a popular supplement, and magnesium itself is an essential mineral that plays important roles throughout the body. But more magnesium isn't automatically better. Today, we discussed 7 mistakes that can reduce the benefits or increase unnecessary risks. Mistake number 1 was taking more magnesium than you need. Mistake number 2 was taking magnesium too close to certain medications. Mistake number 3 was expecting magnesium to cure every health problem. Mistake number 4 was choosing supplements based only on price or marketing. Mistake number 5 was expecting immediate results. Mistake number 6 was ignoring kidney problems or other important medical conditions. And mistake number 7 was failing to tell your doctor or pharmacist that you're taking a magnesium supplement. The most important message is simple. Magnesium glycinate is not a miracle cure. It may be useful for some people, but it should be treated like any other supplement, with care and realistic expectations. If you're taking magnesium because you're experiencing poor sleep, muscle cramps, fatigue, anxiety, or another symptom, don't automatically assume magnesium is the answer. Those symptoms can have many different causes. Sometimes the best solution isn't another supplement. Sometimes the best solution is finding out what's actually causing the symptom. If you're over 60, it's especially important to consider your medications and overall health before adding new supplements. Read the label, follow the recommended dose. Don't increase the amount simply because you want faster results. And if you have kidney disease or take prescription medications, speak with your doctor or pharmacist before making magnesium a regular part of your routine. Remember, supplements should support good health, not replace a healthy lifestyle or medical treatment. Your foundation should always include a balanced diet, regular physical activity, adequate sleep, stress management, and appropriate medical checkups. Magnesium can be one small piece of that bigger picture. Thank you for watching Dr. Bilal. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell for more simple and practical health information for adults over 50 and 60. And if you know someone who takes magnesium glycinate every day, share this video with them. It could help them avoid a common mistake and make a safer decision about their health. Until next time, take care of yourself, stay informed, and remember, the best health decisions aren't always about taking more. Sometimes they're about knowing what you actually need. I'll see you in the next video.